Hi, I'm Jonathan Staiano, and this video is showing you a patient that I've just treated with a indented scar on his cheek. These are sometimes called ice pick scars. They're often due to acne. He had one on the other side of his face from a bit of glass that had embedded in his cheek. This one that you can see in the video has been caused by folliculitis, which is inflamed hair follicles causing an ugly indented scar. They're difficult problems to treat. People talk about subcision, which means putting a needle underneath the scar to try and raise it up, but that's going to create another scar, and the risk is it's going to pull down again. He'd already tried needling, which is another way of treating indented ice pick type scars. But again, whenever doing scar revision, you're creating one scar from another scar. And so in my view, the best treatment, and the treatment that I've done for him, is actually to cut that scar out and to create a new scar. And that's what I've done here. So we give the skin a clean with antiseptic, put a sterile sheet over it, and then inject the local anesthetic. The anesthetic's got adrenaline in it, which means that it often blanches and looks white around the outside. I have to test it's working, and if it's not, I'll put a bit more in, like I am here, and then I'll test again before I do anything. The operation involves actually excising the scar, so I'm going to cut that scar out completely and take it down to fresh fat, so that all of the scar tissue that is dented in, and he's got some little blocked ducts and follicles within this piece of skin, that's all getting removed. I then use a thing called a diathermy, which are these blue forceps, which will stop the bleeding. So this stops and cauterizes any blood vessels so that it doesn't bleed. Once I've cauterized it adequately, then I can make sure that it's nice and clean before I put some stitches in. So these stitches are going into the face, and in the face I tend to use non-dissolvable sutures, so these will need to be removed, but they will give a better scar. So what I usually do to avoid a little bump, which is always a risk, little dog ear, I'll put the two stitches on either end first to make sure it's nice and flat. So I put one at one end and one the other end, and once I've made sure the ends are flat, which is the most important bit, I can then put some stitches in the middle. So I'll put two little stitches just in the middle just to close that wound down, and these stitches will come out between 5 to 7 days. You don't really want to leave them in too long because they might get stitch marks on either side, and you don't want to leave them in too soon because then the wound might open up. So 5 to 7 days is normal for these stitches to be left in. Normally don't use much of a dressing, just put a bit of ointment on or give them a bit of tape. Thanks for watching. That's how I would treat a dented in ice pick type scar on the face. I hope that's been helpful. Please like the video, and remember to subscribe to the channel because we've got some great stuff coming out soon. See you in the next one.